Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, Matthew, tell me what's going on with your elbow, what happened?
Well, so I went and got some x-rays done. I broke my radial head about 20 years ago. I thought maybe something happened in there, but it came back that I have tendonitis in the elbow. And it's been inflamed for a couple of weeks
It's
now.
a little bit swelling, you can see it compared to this side. It looked like a little bit buffy here. You know? It was worse than this?
Yeah, it was really swollen all the way around. Like there was no definition really at all.
Oh, okay. So how long you been having the tennis elbow?
For about a year and a half.
A year and a half. How did you hurt yourself?
I think it was just gradual, playing the piano and maybe using the keyboard for the computer, and just over time it's just gotten worse and worse. So.
And what kind of treatment you had for that? You said you had it for a year and a half, so
basically just ice and heat and some ibuprofen. That's pretty much it.
That's it. Okay.
Yeah.
All right. So what is difficult for you to do because this issue?
Bending, like I can go about right there, which is a lot better.
About like 90 degrees.
A lot better than it was.
Yeah, that's very tight. And what else is difficult for you? Lifting, reaching, and stuff like that. What about extending?
Extending, I'm pretty good. I can't go fully. I can still feel it right there.
You see? Can you see the difference here? So extending, this is look like one piece, like 0 degrees. This is a little bit. I'm gonna measure it now. We're gonna take the measure for both deflection and extension. Okay. So how much pain do you feel there from 0 to 10?
It's about a 3 right now.
Is it constant pain or
it's constant?
So 3 constant pain all the time. And at worst, how much?
It was probably about an 8.
8. And what make it worse?
Well, before it was bad. Just any movement made it. Turning it, you know, it felt like I couldn't get the right angle to lay my arm down.
To find a resting
To find
position.
like relief, yeah. At all. And any touching really caused a lot of pain before. I can touch now, obviously, but.
How much pain when you bend really? 0 to 10?
I mean that goes up about a 5 right there.
So 5 when you bend this way, okay.
Yeah.
So that's.
And even when I go back like that right there, I can
is
feel it.
extension?
It goes about the same. That's it right there.
Remember the number 5 and how much when you extend?
It's about the same on the back.
5.
On
So
the back
5
side.
bending, 5 extension, but it's constant 3 out of 10. On this, do you feel pain going down here or just localized here?
It's just localized here right now. I did have pain down this muscle right here, and even into the side of the hand. In fact, these 2 fingers right here, I couldn't even lift.
Any swelling in the fingers?
Yeah, I did have swelling in the fingers, and I could lift these 3, but these I couldn't lift. I'd have to use this hand to lift it.
Wow. So, anything else?
No, that's pretty much it.
Okay, so I will take your range of motion. We're gonna take it from this side. So this should be 0 actually, like flat. So let's see. Extend.
Right there.
Okay. So he is like about -5. Can you see it here? -5. Should be 0. So he's missing 5 degrees. Let's bend your elbow.
This way?
Yes. Okay. So he is 85. Can you see this? About 85. 1 second. Here you go. Can you see the 85 here? Okay. So remember this: 85 and -5. Okay. So make sure what I'm doing is not really aggravate your symptoms. So you said it's the tender here? Is it tender?
Yeah, it's like all of that actually, like right there.
Painful? It's painful? Okay. Let me do a couple of things. Let's see. Feel the scar tissue here. It's not. Okay. Can you see my hand here? You see how it's bumpy? Look at this. It's like a piece of rock inside here. See that? Good. So we're gonna work on this. Make sure it's not too much, okay? How does it feel?
That's pretty painful.
Sorry, wow. Okay. What about now?
That's good.
Okay. What about this?
Oh,
That's alright.
yeah.
Okay. Is it too much?
No, that's fine.
And then gonna get cool.
Yeah, that's the.
Okay. Let's get the other needle. Alright, so let me see if this is more tolerable. How's this?
Yeah,
Is it okay or
that's
is
better.
That's better. Okay.
I can handle more that way.
Yeah. That's
That's a little painful.
so you definitely have some inflammation here. You visually can see it, but we're gonna know today if you're pain from the proliferation, because that could be you're paying more from the proliferation. So we'll see. You have inflammation, we gotta work on it, but we'll work on inflammation too. Is that too much?
No.
How's that?
That's good.
So this is a spot, yeah?
Yeah, maybe go a little more that way.
I feel the scar tissue.
You can feel it right there?
In this spot. That's why I'm going here when I palpate it with my hand. So, yeah, here it's okay, but I feel it's thicker here. Feel this one? Yeah. There's more in both of them. How does it feel now? Can you feel this one here? So you play out a lot of piano, or?
Just recently. Yeah.
Are you doing like a correct way of playing, or just you know how to play?
Yeah. I mean, I took lessons when I was when I was younger.
Because sometimes if you don't take lessons, you will develop that habit. You will.
Right.
Yeah. Make sure when you play, like every 20 minutes, you need to stop. Just walk around.
Okay.
Yeah. Move around, so this way you're not really overtraining. You know, you can come back, but after a minute or two. How long you were training?
Sometimes a while.
How many hours?
About an hour.
About an hour.
Yeah. So yeah, I will break it, set a timer and something like that. I definitely want you to do that. It's fun. I like to play piano and keyboard. I play guitar too, so it's fun. But don't stop. For now, hold on this. So we're gonna test a couple of things here, and if you're gonna play some music for us, we'll let you play. We'll when we try it after cleaning it, but not for the next couple of days.
Okay.
We'll try it like 10 minutes, 15 minutes, see how you feel. If everything is fine, that's your range. You can increase it by like 5 minutes or something like that each session, but the session has to have a break in between. So this way. But rule of thumb, even after everything clears up, if you go back to the hour and a half, you're gonna have an issue.
Yeah.
You know why? Because you have the risk factor of the radial head fracture. So you really, that's, you know, when I looked at the image, yeah, it's healed, but it's not perfect. So it's gonna rub a lot on the tendon there, especially when you do repetitive stuff. So we want to make sure you know, play smart, not hard.
Right.
You know. So he's paying attention to this one. I'm like, all right. Got the big one here. Try to hide it, don't see.
I close my eyes.
How does this feel?
That's not bad.
Yeah, it's not needle, okay? Any shoulder issue, neck issue?
I did have a stiff neck before this flared up.
Mm. Do you still have it, or the neck is fine now?
There might be a little bit there. It's pretty good though.
Okay, let's roll this up. You feel this bump?
Mm-hmm.
That's a scar tissue. See that?
Mm.
Do you want to feel it?
Oh, I felt it. I've been massaging him.
You were massaging
Yeah,
there?
that's painful.
You massage
down there.
therapist?
No, but
You felt this
I know how it
bump.
feels in my own, so I'm like, there's
Yeah.
a spot right
You
there.
can feel it with the hand.
Yeah,
But you see, look.
yeah.
It's vibrating here.
Mm.
See that?
Oh, yeah.
Oh. Can you see this? Slow motion. See that? It's especially here. He has a little bit here, not too bad. Relax your shoulders. There you go. Okay. Hmm? You hear that?
Is that him?
So doesn't know. Yeah, that's him. No, it's not me. I don't know. I'm perfect. Yeah. This is because it's a bone, so it makes more sound. He does not have a lot of fibrosis there. Some patient has fibrosis there, like a scar tissue. It's gonna make that sound plus the grinding, the vibrating thing here. You sure you don't want to feel it?
Yeah, I know.
I'll give you the option. Yeah, a lot of family members like to feel the scar tissue. That's why I offer to anyone to feel it. So it's very cool actually, because you really can feel it. The thing is, it's overlooked because you cannot see it.
I know, I had
You
I had a person break up my scar tissue up here.
Yeah. Did they break it up? Or?
Mm-hmm.
Yeah.
It felt great.
That's good.
Way more range of motion after
That's
that.
beautiful.
Mm-hmm.
Is that too much?
Yeah, a little bit lighter.
Sure. Yeah.
Mm-hmm.
Let's see this. So your fingers here are fine now? You
Yeah.
don't have an issue with that? Okay.
I just feel maybe a little bit swollen, a little puffed up.
Yeah, I can see like it's a little bit swelling. It's not too bad actually. Not too bad. It's okay.
Alright.
Let's drink some water and tell me how is the constant pain, because you used to say it was constantly out of 10 and it was 5 out of 10 pain here, 5 in here. Do you remember the number for the range of motion? You put it here. It was minus 6 and what else?
-5 and
Yeah.
Minus
Was it
5
85?
and 85.
Mhm.
That's not a lucky number, okay.
Mm-hmm.
All right, let's do it again. Move your arm and tell me from 0 to 10 how much pain. Okay. From 0 to 10.
Maybe like a 4. I
4.
don't know.
What about the
It's
constant?
about the same, I would say.
Mm-hmm. Okay. Move it around.
Yeah. It's
What about the
same.
constant pain?
It's gone down a little bit.
0 to 10?
I would say probably a 1
Where do you feel the pain when you bend?
right here.
Right in there.
Mm-hmm.
When you bend and when you extend in the same
About
spot.
the same spot.
Okay. Do you need that spot? Yes.
Yeah. Just cut it off.
Yeah. So that's what prevents you from going.
Right.
That's what you feel the pulling. Okay.
Yep.
Too much?
Right there. It's really sensitive right there.
Sorry.
Yeah.
Okay. What about here?
No, that's not bad.
Mm-hmm. Right. Okay. You see this? Nice and smooth. Cutting a little bit scar tissue, but it's not grinding.
Mhm.
Like,
This muscle spasm, yeah.
yeah. Well, he has some inflammation, so. Head trauma, accidents, falls. What's your past medical history? Falls, trauma, accidents. What is falls? It's
Pretty good.
been a little bit better.
Yeah.
Look at this. Let's do it a few times. Any pain or it's gone?
There's still pain there.
0 to 10.
It just depends. If I go back to the angle it was, then it's not as much. But if I go further, then it's the same.
Well, the good news is actually what I expect. Relax. What I expect, you gain range of motion. As long as we're getting more range of motion, that's
Yeah.
good. That's mean we're shaving. So
Yeah.
yeah, you're gonna continue feeling the pain until we totally really
Right.
get rid of it. But the good news is going further, and you feel the pain. So we're gaining range of motion. That's a very typical sign that I look for. You know that we move into the right direction.
Right.
But you really did not have any sports injury or trauma hit your head, like ever.
Not really. Well, right here, just one time chasing my sister when I was really young.
Who won? I'm just joking, but
The wall.
did you have sutures or anything?
I had stitches, yeah.
How much?
Just about that far. Right
Oh,
here.
is it okay to work on it?
On my
Yes.
head?
Yeah.
That's
Okay.
fine.
So let me explain it to you because it's mine. Okay. So in the body we have a fascia system called fascia. It's like a Spider-Man suit, very thin layer under the skin that's wrapping everything. Okay, that's a superficial fascia. So when you have fascia restriction, it's like you're wearing a T-shirt or the Spider-Man suit. You wear it and it's 2 to 3 sizes too small. So if you have tightness in certain areas, it affects the entire body. When you have a past medical history of trauma or accident or surgery, there is a high chance that fascia causing your Spider-Man suit very tight in here and pulling everything.
Mhm.
Very good example actually. We can visualize here, okay? Let's say this is your fascia, okay? This is your fascia, okay? Lift your arm up. You don't have any fascia restrictions here, okay?
Okay.
Is that as far as you can go? Okay. Relax. I'm gonna cause fascia restrictions here. And that's exactly what the fascia does. Lift your arm up. You see how far you can go?
Yeah.
Okay. So it does the same thing.
Okay.
It does not give you room to move. That's why I would like to, if it's okay with you, to work
Yeah, that's
on
fine.
this area to see it might affect it, it might not.
Mhm.
It's usually 30% is actually could be other areas from the patient. I just don't want to take a chance with you just focusing here and missing something.
Right.
Does that make sense?
Yep.
Oh, hey. Now we are awake. Oh boy, you definitely have some inflammation there.
Yeah.
Okay. Is that too much here?
No.
Okay. I feel there's not here. Is that too much?
That's alright.
You see, it's the same pressure I'm doing here. But because there's inflammation here, it's very sensitive.
Mhm.
But because there's not much here, you're tolerating it. We're gonna work on inflammation today actually. Is that too much?
No, that's okay.
Okay, try it again now. Bent. How's that?
That's better.
You're going further.
Yeah.
Try it a couple of times. Just keep going. Don't think about it. Don't look at it. Good, and keep going. Don't think how far you can go.
Okay. Just.
Keep going. Okay. And we can look at it and do it slowly and see how far we can go now. Stop.
So go slow now.
Do it one more time slow. Okay, that's
like
good,
that.
but it's not perfect. Do you still feel pain or is
Yeah, I still feel it right
the
here.
end range? Yeah.
Mm-hmm.
Okay, that's good. Well, we're gonna bend it further now. Is it painful here?
Mm-hmm.
Is it okay to work on this area?
Mm-hmm.
What is the structure? Okay, we'll figure out. Compared to this. I'm able.
I think it's the same.
Is that too much?
A little lighter.
Hmm?
A little lighter.
Okay.
On that side.
So it's sore. Compared to this is really
Mhm.
okay. And that's exact same pressure. Can you tell the difference?
Oh yeah.
When you have restriction, it's a little bit
This
sensitive.
side
Is it too much
It's
what I'm doing?
sensitive. This side is not.
Yes,
at all.
so we find that, okay. Let me know if it's too much, okay? Sorry, is that too much?
That's good right there.
Okay. Too much?
No.
Anything else?
Mm-mm.
Any other trauma or falls?
Oh, that's painful right there.
Is that painful? You can have a seat in that chair. This one.
Good.
Sorry.
A little much right there.
Sorry. Mhm. We finished with his elbow. We'll work on the other issue. Yeah, we're still working on the elbow, but
Oh,
the-
that's sensitive right
but
there.
the other elbow.
Yeah.
Yeah. You know what happened here?
I didn't know what happened, but
Yeah. He had the switchers here. But did you have concussion when that happened?
I don't think so.
Mm-hmm. Do you get headaches?
Once in a while.
Okay. What do you mean once a while? Once a week? Once a month?
No.
once every couple months.
Yeah.
It's not bad.
Not too often, really.
But you said your neck is not stiff anymore, yeah?
Right.
Okay, let's move your elbow and tell me how that feels. And tell me if working here made any changes.
Mm-hmm.
Okay.
It's about the same.
It's about the same. Yes.
Mm-hmm.
Okay. Let me do one more thing here. Okay. You feel now, is it tender as it used to be, or it's
No,
It's
it's
okay.
not as tender.
start to release? Any difference?
I mean, it's about the same,
Mm-hmm.
and there is more range,
I
but
want you to do it like this way so we can
Oh,
go
yeah.
further.
Yeah, it's painful right there.
Okay, stop. Alright, so any problem with your shoulder?
It feels pretty good.
Is it okay to take your shirt off?
Yeah.
Okay.
On camera though?
No, that's okay. Alright. We're not gonna do that. So nothing happened to this shoulder? Yes?
No.
Okay. You feel the tightness here? Oh,
Yeah.
have you had back surgery?
Yeah. Had
Okay.
the fusion, yeah.
What level?
4, 5.
Okay. It's okay to work on that area?
Down, yeah.
Yeah.
Mm-hmm.
Okay. 4, 5. You had
Mhm.
fusion. How long has it been going on?
That was 2010 I had the surgery.
2000.
So 8 years ago.
8 years ago. And everything is okay there?
Yep.
Okay, that's good. So let's lean forward a little bit, just to scoot forward. Okay, make sure it's not painful. Any pain? Was okay.
No, it's good.
Mm-hmm. We gotta work a little bit on your posture, but
I know.
Too much was okay.
That's good right there.
You shrug your shoulders a lot or slouch forward.
Yeah.
Yeah, that's probably why. That's why you have scar tissue in your traps. So we're gonna go over ergonomics with you just to make sure you're not building more scar tissue, and that's in the front computer. Yeah.
Okay.
You do a lot of long hours on the computer.
No, not really.
Too much is okay.
That's good.
How's that? Going actually deeper with this one. You still liking that. See the difference between here when you didn't have a lot of inflammation compared to inflamed elbow? It's very sensitive to touch when it's inflamed. Too much was okay.
It's alright.
I'm just resting here. Okay. So let's move your elbow and tell me how that feel now. Let's get some water. Let me see the other elbow too. Bend the other elbow.
This one?
Okay, we want to get that far. Okay, let's do this one. How much now from 0 to 10?
About a 3.
Where do you feel it?
Feel it right here, the tightness.
Right.
I'm sure you'll get it.
Moves
Too
around.
much. Too much.
No, it's okay.
How's that?
That's good.
See them? You see this? It's like it's sliding in. Even I'm trying to get it this way. It's sliding in. Too much?
Yeah.
No, sorry. Too much?
Yeah.
Okay, sorry. Yeah, if inflammation is not an issue, we should get the full range of motion today. So we'll see how far you can go.
Okay.
Okay. But we'll see. It's a big scar tissue, so we're gonna work on it more. Let me get here. Let's see. Too much? Okay, try it again. How's that?
It's getting a lot better.
Yeah, you're bending
Lot
further.
better.
Yeah.
Mhm.
You're bending further. Where do you feel it now? Like, what's stopping you?
Right there, and it's like the angle that I come in at.
Like back coming this
So-
way, but because you wow,
See,
that's
when I
very
turn like that, then I feel
where
a lot right
Mhm.
there.
in
Yeah.
this spot. Yeah,
Mhm.
relax.
When I go that way, I can go further.
Okay, but you see how far you can go.
Mhm.
We were 85 degrees. Okay. Alright. Make sure this is okay. How's that? Sure, it's okay now? Okay.
Maybe a little lighter.
Sure. What about now? Okay. And by the way, I'm not really doing a lot of force. I'm just a little bit sensitive, you know.
Yeah.
Mhm.
Mm.
Yeah, I know. I couldn't even blow on it last
He's
week.
sensitive, yeah, because he had, like, yeah, you guys, you're saying you had more swelling there.
Yeah.
So, yeah, you see, like, when you see in that graph I showed you,
Mm-hmm.
the inflammation, swelling,
Mhm.
redness,
That's what
pain, you know, increased
Yeah.
temperature, you know,
Mhm.
pain, it's
It's
part of the
hot.
sensitivity he has, you know.
Yeah.
How's that?
That's good.
I can really go deep with this part because it's not as inflamed as the back. Too much? Mm-hmm.
Yeah.
Try to distract him.
Yeah. I see what you're
Yeah,
doing.
the weather is beautiful here. It's nice, you know. Yeah. Look at the window. There's no window.
Sensor right there. Up there, yeah.
Try it again. How's that?
Yeah, it's good.
Let's drink some more. How's that?
Yeah, I mean, it's getting there.
Where do you feel it now?
Just feel it right here.
In that spot? This is a new one. No, don't point.
Yeah.
It's like I'm trying to help you here. We're not gonna fight. Is that too much?
It's over this way a little more.
Too much? Yeah.
Okay, good.
Yeah.
I think it's more that way.
Mm. Try it again. How's that?
Yeah, it's getting a lot better.
Mm-hmm. Okay. Okay. Any pain or it's gone?
No, it's still there a little bit.
How much?
Probably about a 3.
Where?
Right here somewhere.
Okay. I'm glad he doesn't kick.
Yeah, no.
That was very close. Almost there. Okay, try it again. How's that? Look how far you can go.
There's still a little bit there.
0 to 10?
Yeah. It's about the same. 3.
Hold it here, hold it here. Sure. Okay, try it again and tell me how that's right. So you went a little bit further. How's that? Still feel it?
Still
It's
some
gone.
pain there, yeah.
0 to 10?
Yeah, still about a 3 right there.
In that spot.
Mm-hmm. That one spot.
Actually, let's hold it here.
Right there?
But make sure it's okay. It's not big. Is it
Right
okay?
there, yeah, down more than that.
It's a little bit inflamed. Okay. Okay, you remember the numbers? -5. Okay, can you straight your elbow, like backwards? Okay, right there. Can you get a close shot? Okay. So it's now like, a second, here we go. It's like a -3. It's not bad. Okay. Let's bend. That was 85. Okay. Sorry. That's
all right.
Here you go.
Let me hold it.
Yeah, I'll just bring it up. Okay, sorry. Sorry. That was 85. Now look at this. It's 115. You see that? 110, 115. It was 85. Moved around and tell me how I feel. So 85 to 115, that is beautiful. Good. Alright, so how you feel?
A lot better. Yeah.
What do you think about the ASTR treatment? Just
I
working
think
on
it's
it.
great.
Yeah?
I'd recommend it, yeah, definitely.
Yeah. Awesome. Thank you so much.
Yeah, I appreciate it.
Thank you. To subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.